I think good leadership is essential working in the NHS and the community.
Good leadership means everything. Communication is the key, particularly in the community, because we need to link in with so many other people.
I've worked with good leaders in the past, and the best ones are the ones that motivate you and inspire you.
It's important that no area of the community feels isolated.
You need people that you can rely on, you can go and speak to, and that will point you in the right direction.
I'm a community matron. That title sometimes conjures up an old-fashioned matron idea where you might be in charge of a team or a ward or whatever. But in community that's obviously very different because we don't have a unit or a ward area. So I'll liaise with the GPs and the social services and the hospital. But mainly when someone asks me who I work for, I'll say the people of this community.
I'm a community dietitian for Leeds Community Healthcare NHS Trust. Today I'm out visiting patients who are at risk of malnutrition, and I'm helping them to meet their nutritional needs. I think one of the biggest challenges community staff face is the increasingly diverse population, the gap between the very wealthy and the deprived, and also the ageing population. And with the ageing population comes complex and long-term health conditions that require a complex management and treatment plan.
I'm an advanced nurse practitioner. I have lots of interactions with different disciplines within the community setting: district nurses, health visitors, community matrons, anybody that comes in contact with patients out in the community. The community that I serve is a particularly one of the poorer urban communities. A lot of mental health issues, drug abuse, a lot of chronic disease such as diabetes, heart failure, heart problems, respiratory problems. So that presents a number of challenges that good leadership is essential in combating.
A good leader makes a massive difference to community staff. A good leader should be able to empower their staff and have a clear vision and strategy.
Good leadership involves collaborative working, and that means working across the board in your own unit, so that's within the practice, but also reaching out to other members of people who are working in the community alongside and with your patients. So good leadership actually means a very good communication with other agencies who work with your patient in a joined up approach, and that then will hopefully deliver good care and a better patient outcome.
Leadership is important to me because I'm working quite isolated in the community, and I have to link in with other teams and be able to communicate closely with them and find out what their views are and their limitations are. But it's important to me that I'm kept well informed, and that also the leaders listen to the ideas of the staff and help us to use our initiative in developing new ways of working and perhaps new ideas of how things might be more efficiently run.
A good leader will put patients at the heart of the services that they provide, and will develop good working relationships with not just the public but with staff and with the stakeholders and the commissioners.
Leaders must be there to provide a good example. If they don't provide good communication and link in with everybody, the rest of the team won't.
Leadership in a community setting is different again, because you have very independent workers. It can be quite a lonely place. You can be surrounded by a team, but it's still quite lonely, and the leadership is making that team cohesive. It's not just leadership, it can't be any old leadership, it has to be good leadership, and that's what makes all the difference. You need an inspirational leader, somebody that leads from the front, that's done the work, that knows what they're doing, and that can motivate people.
You need a role model and a figure that you can look up to, that is a good communicator, that can link all the various aspects of the community together in one to provide holistic care for your patients.
You want to do the job, you want to do it well, you want to make the difference, and that's what leadership's about, motivating people to do that.